everyone, we're back here at Shift Physical Therapy. I've got Dr. Taylor, the chiropractor at Willowbridge, and myself, Dr. Renee, the physical therapist here at Shift Physical Therapy. We are continuing our video series about pregnancy. So today we're talking about the third trimester. We're going to be going through some demonstrations of maybe some positions of comfort that will help during this third trimester. So visiting that good, bad, and unknown. Today we're going to talk about some good positions to get into.
Yeah, and so as we are in our third trimester, our body is changing. We have a lot of things going on. We're getting a little bit more uncomfortable. We might be having some more pain that we're not really used to, whether that be some upper back pain, low back pain, Braxton Hicks contractions happening. So we're just going to talk a little bit about some things that may be helpful in this third trimester, just make you a little bit more comfortable. So we're going to start off by talking about the altered biomechanics of the body and the spine as the baby is growing. So we're going to have Jackie come on in, and I'm just going to briefly talk about what we're seeing as that belly is growing and what changes the body is having. As we know, there are a lot of changes going on, and we just want to kind of give you some tips to help relieve some of that tension or pressure that's going on. So when we are pregnant, we see that our belly is growing, correct? And then we're seeing that our forward head posture is going to start to occur, So our head is going to start to go forward, and that's because our shoulders are going to kind of start to round. And we're kind of compensating for that belly that's growing, which is then going to kind of cause that low back pain to start to occur. And then it's going to shift our hips forward just to kind of compensate for that belly. So it's really important that we're getting our spines checked just because of all the changes that are occurring. With those rounded shoulders and that upper back tightness, it's putting pressure on our cervical spine throughout our neck, which may be causing some headaches. And then obviously with that anterior pelvic tilt, where we kind of see our hips shifting forward, we are seeing that pressure on that low back. Yeah.
All right, so let's take a look at a couple different positions that may be a little bit more comfortable if we add a few tips or tricks here. So I'm going to have Jackie laying down as if she was going to bed tonight. The safest position to lay in during that third trimester is really onto your left side. So once we get Jackie laying on her left side, we're going to just add a couple of things that may make it a little bit more comfortable for her as she's laying. So one thing that we want to note is the position of the pillow here under her head. We want a pillow that's going to really come meet her just so that it's keeping her spine in a nice neutral position. If the pillow is too thick, it's going to kind of be tilting her head upward, or if she wasn't using a pillow at all, we would see that head tilting downward. So positioning that pillow so we keep that spine in nice straight alignment here. And then we can also add in some pillows in some other places as well. So adding in a pillow between the knees is just going to help so that as she rests down on there, it's going to keep the hip and the knee in a much more straight alignment versus pulling downward.
And then we can also add a pillow up to the front if we needed to. Sorry, Jackie, I don't want to cut you off there, but that's just going to help so that our thoracic spine, so that mid back and the low back and the hip aren't kind of torquing forward and putting pressure along her spine as well. So we kind of talk about too that there are definitely products that you can have. There's so many different products you can buy, but you can also just be using pillows as well. Will work just fine to help relieve that tension along the spine and kind of create a more comfortable sleep.
All right, so then the other position we're going to take a look at here briefly is the seated position. So we're going to have Jackie come on up for that next demonstration. So we're going to talk about the seated position next. And at home, if you're working from home, this might be a good time to switch to using a ball instead of a chair. And the ball can help with a couple of different things. It's going to help you so you've got nice even weight distribution between the hips. And then you're also it will help with a nice upright spine posture as well as keeping those feet nice and flat on the floor. So if you don't have a ball available for use at home, there are some other tips and tricks that we can use in a regular chair as well.
Yeah, so what's going to be important is that we are using some sort of a lumbar support. And what we recommend using is just actually rolling up a towel and placing right behind your lower back where you're going to sit. And this towel is a little bit thick, but Jackie's kind of short, so it works out okay. But if you can see, her feet are flat on the floor, and you might not be able to, but they are. And this is just allowing that even weight distribution if you don't have that access to the ball, and allowing Jackie to kind of engage her core and also keep her shoulders back and keeping her head in a neutral position over her spine.
Another thing that the ball can be helpful for at this point, that the ball is actually a great tool during the birthing process as well. So getting into that third trimester, using the ball and getting comfortable with that position on the ball can be helpful during labor and delivery as well.
And just to make sure that you are getting up and walking around every hour or so, maybe every 30 minutes, just to kind of keep that blood flowing and having some circulation going on. We just don't want you sitting too long in one position.
So we hope that some of these tips and tricks that we have for you during your third trimester can help you stay a little bit more comfortable, and we wish you the best in your delivery.
We hope you enjoyed the video this week. Join us again next week for the fourth and final video where Dr. Taylor and Dr. Renee will talk about what mom can expect postpartum, as well as the benefits of chiropractic care for baby. See you all next week.